on this episode of Clear the Air.
And he saw a reduction in mortality from 25% to less than 2%. And the doctors of the time ridiculed him and they laughed at him, and he's like, why are you laughing at this? This is such a simple solution. In my own nutrition journey, I read a couple of books that made sense to me and made me want to be a vegetarian. And I was actually a good solid vegetarian for like a year, but I blew up to like 325 pounds. And so obviously it doesn't work for me.
It seems like more and more data has come out even subsequent to that, studies and everything.
Oh, yeah. There's all kinds of studies. Again, the FTC doesn't like it, and so they say you can't share it. Hello, and welcome to the Clear the Air podcast. I'm your host, Nate Jones, with Joel Melton.
Hey, everybody.
In this episode, we're going to take a look at how to solve pandemics, how they've been solved in the past, and what can be done to more effectively solve them in the future. As you know, it's now 2024. We're 5 years, 2020, 21, 22, 23. We're almost 4.5 years in the rearview mirror of the COVID pandemic. And we have firm belief that could have been solved a lot easier and a lot cheaper than the trillions of dollars that were spent. And we're going to discuss that and ideas of how to do that in this podcast today.
So it seems like many of the world's population now has defined, as you just mentioned, you counted off 4 or 5 years, defined ourselves from 2020, when the pandemic that we most all frequently refer to occurred. Pandemics have plagued the earth for centuries. And more likely, since the beginning of time, they've been around, and whether they've been recognized or not. Tell me what history teaches us about pandemics.
Well, there have been pandemics, not just centuries, but millennia. They've been going on for thousands of years, since before mankind. There's probably been pandemics and epidemics in animal kingdom before humans were around. But they've always been solved through improvements in hygiene and sanitation measures. They've never, ever been solved through vaccines or even pharmaceutical interventions of any kind. You could make a very weak argument that the polio epidemic was solved by a vaccine, but again, that would be a very weak argument because the epidemic part of that was well in the rearview mirror before SALT came out with the vaccine. And so the epidemic was not solved, and if you believe that vaccines work, which a lot of people do, that was still in the rearview mirror. And vaccines help prevent. The concept of a vaccine is that it helps prevent something, not really that it solves it right in the middle of a crisis. And I think that's why during COVID there was such a controversy, and there still is to this day, over the wisdom of vaccinating people in the middle of an epidemic or a pandemic. And, I've read a lot. I've been in this field for 25 years. I did not go to college for it, but I have been in the hygiene business for 25 years, and I've learned a lot. Very expensive, much more expensive than a college education, because I fund research projects where you're looking at that. And those research projects, funding one of those would have paid for 6 years of college. But we're learning more and stuff like that. But you can go back through history, and the father of hygiene is considered to be a doctor by the name of Ignaz Semmelweis, and he was a doctor in Vienna. He was Hungarian, but he was a doctor in Vienna in the mid-1800s, and they were having an epidemic there of puerperal fever, which is an infection that the pregnant mothers were having. They would come in and see the doctors. They would get sick with it, and they would die, or their babies would die, or both. And about 25% of the patients were dying. So that they would come in, they would be giving birth, and the doctors would go from working on corpses, cadavers, and come in and without washing their hands. Again, they didn't have the idea of germ theory, but they would come in and start working with these women giving birth, and about 25% of them were dying. And this guy, Ignaz Semmelweis, he actually started washing his hands with a bleach solution. And the interesting part of it is he didn't understand germ theory. At this point, they thought that these infections were passed and transmitted through miasma, which is vapor. It's odors. And so he was actually just using bleach to take the odor of the corpse off his hands before he went and worked on these pregnant women delivering their children. And he saw a reduction in mortality from 25% to less than 2%. And he wrote about this in the medical journals, and the doctors of the time ridiculed him and they laughed at him, and he's like, why are you laughing at this? This is such a simple solution, and it reduces mortality from 25% to 2%. So why are you laughing? But the other doctors, they would not bite on washing their hands with this bleach solution. Today, looking back, we understand that he was actually just killing all the bacteria and the viruses that were on the cadavers. But back then, they didn't know it. But what he did know is that it was effective. So he's considered the father of hygiene. Another great story would be the father of epidemiology, who was John Snow. He lived in London about the same time, a little bit later than Ignaz Semmelweis. But they constantly were having these cholera outbreaks in London, and John Snow was a doctor, and he goes, we've got to find a way to stop this. And so he actually did a plot map of where people with cholera were living and where they were catching cholera. And what he found was it's all centered on a pump, and it's called the Broad Street Pump. Everybody in epidemiology knows this. He famously went down and said, hey, this water pump is where this is happening. Something's happening with the water pump here that people are getting sick with cholera. And the other doctor said, no, you don't know what you're talking about. It's the smells in the air. It's the miasma. So he famously took the pump handle off the pump so no one could get the water. And the cholera epidemic ended. So he had the reason, he had the suspicion, and he actually showed that it worked. And interestingly, he actually lobbied the British government to put a sewer system in London so that you could get all of the sewage that was in the streets, because at this point people just threw it in the streets, and then it would flow down the streets to the Thames River. But he famously fought, and the city of London said, no. And then when he died, I think it was 2 years later, they put in a sewer system, and they've never had a cholera epidemic since. And I think they did it just to spite John Snow. So he's considered the father of epidemiology, and there's a lot of other people in the world. I mean, many of them are living today that have contributed to hygiene and sanitation methods for ending epidemics and pandemics. And usually when these doctors, because I'm trying to think, but all of them that I can think of they're all physicians. But when they're proposing something that's not a pharmaceutical solution, they get laughed at. They get ridiculed. Oh, that's too simple of an answer. Oh, it can't possibly work. And I've seen that in my career. I've seen that over and over, talking about hygiene solutions for a lot of healthcare issues. The medical establishment, they've been educated to understand that pharmaceuticals are the answer. You have to have a drug solution for everything, a pill solution for every healthcare issue. And so they're trained not to want to accept hygiene. And there's a lot of very good doctors out there that do acknowledge that hygiene plays a part. But again, there's a bunch of them that don't.
So a little closer to home, those are two good examples. But in New York City with Sarah Jo Baker, tell us about Sarah and exactly what you were just saying.
So Sarah Jo Baker, again, was a physician. I think, don't quote me on this, but I do believe that she was the first female physicians to graduate from, I think she went to Princeton. But she was the first epidemiologist or physician that was hired by New York City to try to help end the epidemic they were having of young children dying in New York. And she famously said the soldiers in the trenches had a better chance of surviving than a child in New York City. So they put her in charge, and just by teaching, and she would go around to these immigrant places, these poor slum part areas in New York City, and she would teach the people, the women mostly, how to boil their water, wash their hands, boil the water before drinking it, and boiling the milk before they fed it to their kids. But a big part of that was bathing and washing the children. Again, all of those are hygiene and sanitation solutions, and she reduced the death rate of these children by, I want to say it was almost 80%. It was quite substantial, the percentage that she reduced it. But she reduced it enough that the doctors of New York City petitioned the mayor to get rid of her because they thought they were going to lose their patients.
History repeats itself because every one of these circumstances are by the simple things that they're doing. And it seems like the establishment every time wants to just push that away for more complicated or unproven issues.
Or more expensive issues. I mean, that's what we find is that if something's expensive and invasive, then it's got to be better.
It's got to be better, huh? Yeah.
Yeah. I mean, even, we deal with the utilization of xylitol in hygiene products. And, the studies and all of the research and the data that come from behind that actually stem from a doctor in Finland, a dentist. And his name is Kauko Mäkinen. He's still alive today. But he started doing research in the 60s looking at how xylitol was preventing tooth decay. And how that came about is during World War II, the Finnish people didn't have a source of sugar. And so they started making xylitol, which is sugar made from wood. And it's a different structure than sugars that we're familiar with, the 6-carbon sucrose, glucose, fructose, those sugars. This is actually a 5-carbon sugar. And during World War II, Finland didn't have a source of sugar, so they started making this wood sugar. And that's what they used because they didn't have the other sugar. And it wasn't for about 20 years, I guess, that they started realizing that the kids who were born and grew up during the war weren't having tooth decay like the rest of the population. And so they started doing research, and what they found was that the utilization of xylitol changed the bacteria in your mouth away from the strep mutans that creates the acid and causes tooth decay to other strains of bacteria that don't create acid. Again, this is a non-pharmaceutical approach to kind of end tooth decay. And we've known how to end tooth decay for 30, 40 years now, and we just choose not to. And let me go back again. We are a hygiene company here at Clear. And the definition of hygiene in the dictionary is acts of cleanliness for an improved health outcome, like washing your hands, brushing your teeth, taking a shower. Those are all hygiene things. And your whole goal in that is to improve your health outcome. And really what that should say is that your actions of health to maintain a state of eubiosis with your gateway microbiomes. Because if you have eubiosis, that's balance of the bacteria in your mouth and in your upper airway, we know, you're not going to get sick nearly as often. In fact, it's almost by definition because dysbiosis, if you have a state of dysbiosis, which is unbalanced, then that's usually when people get sick.
Basically, going back to oral health, we're still doing sick care instead of health care or doing something to prevent it, right?
I've been in the oral care space talking about xylitol and toothpaste and mouthwash, chewing gum with xylitol now for a quarter of a century, 24 years. And I still, to this day, I can't understand why the American Dental Association refuses to acknowledge that caries, that tooth decay is a bacterial infection and should be treated as such, as opposed to a structural issue, which is, they claim that fluoride works to remineralize your enamel, to make your enamel stronger. But if you're going to sit here and say, okay, this makes your tooth stronger, but we're not going to address the issues of bacteria in your mouth, and I use the analogy sometimes of a castle sitting on a hill or a house burning, not treating the bacterial infection and just using fluoride in oral care and calling it good. That really is kind of like saying, hey, carpenter, my house is on fire. Can you go in and rebuild it? Instead of saying, hey, let's put the fire out and then rebuild the house. And I use the analogy of a castle on top of a hill. Hey, you have a castle up there, you want it to be strong, and fluoride is what we believe makes that masonry strong. So if you have an invading army of bacteria and they're putting all this acid in their catapults and their trebuchets and shooting it up there, why aren't we getting rid of that invading army of bacteria and letting our teeth remineralize?
Yeah, so it's truly an unaddressed pandemic.
Tooth decay is an unaddressed pandemic. In fact, I think the fact that we still have tooth decay at the levels that we have it, I think is one of the biggest travesties of our healthcare system. I think public health knows how to stop it. They know that just handing out xylitol gum in the schools at a cost of about $25 a kid per year would reduce tooth decay to practically zero. And not only that, it would reduce respiratory infections by 40%. But yet public health, I've talked to them. They know what it does. They know the science, but they won't implement programs to do that. And that's not a financial interest on us, because if people were handing out gum in the schools, people would probably buy less of our product. But I still think it's something that should be done.
Yeah, that just draws a nice correlation back to Dr. Semmelweis, right? Wash your hands, simple, but the establishment didn't want to hear that. So that seems similar in this case. I think that you brought up some good points here with Dr. Makinen, and we'll get into Dr. Jones in just a minute. But I think starting out, you have a pretty interesting book there.
Yeah, so this is actually, I consider it the Bible for public health. I've read it a couple of times. It's called Pandemic Century, 100 Years of Panic, Hysteria, and Hubris. And it's written by Mark Honigsbaum, who I would like to meet someday. But I'm going to read the back of this, because this book actually, what it talks about is all of the epidemics and pandemics that we've had in the United States in the last 100 years. And there's been one roughly every 10 years. I mean, you had the Great Flu pandemic of 1917, the 19-teens. And then you had one that was a parrot epidemic, a parrot flu epidemic. You had another one, the Legionnaire's disease that was happening. There's been a bunch of them, Zika. But all of these pandemics and epidemics were solved through improvements in hygiene and sanitation. And he goes into that in these books. I don't think that was his thesis. I didn't get that from Mark in his book, but that's what I got out of it. But I do want to read the back cover of it. He did a revised one after COVID-19. The one that I had before that was prior to COVID-19 had a different thing on the back. But it says, how can we understand the COVID-19 crisis? Ever since the 1918 Spanish influenza pandemic, scientists have dreamed of preventing such catastrophic outbreaks of infectious disease. Yet despite a century of medical progress, viral and bacterial disease disasters continue to take us by surprise, inciting panic and dominating news cycles. In the pandemic century, a lively account of scares, both infamous and less known, medical historian Mark Honigsbaum combines reportage with the history of science and medical sociology to artfully reconstruct epidemiological mysteries and the ecology of infectious diseases. We meet dedicated disease detectives, obstructive or incompetent public health officials. Wait a minute. What? Let me start and read that again. We meet dedicated disease detectives, obstructive or incompetent public health officials, and brilliant scientists often blinded by their own knowledge of bacteria and viruses, and see how fear of disease often exacerbates racial, religious, and ethnic tensions, now with a new chapter and updated epilogue on the coronavirus. So even he was talking about how public health officials and brilliant scientists are often blinded by their own knowledge. So, but anyways, I think that is a book that anybody going into public health should read, because it really just drives home that if we really want to prevent another pandemic or another pandemic, the way to do that isn't through mRNA. It's not through vaccines. It's through hygiene and sanitation measures, making sure that we live in an environment where our gateway microbiomes, our mouth and our nose, can maintain a state of balance and eubiosis.
So arguably, the last century is the most progressive in the medical world in terms of discoveries, in terms of treatments and everything. Yet, as you just mentioned, we go back to those 100 years of the pandemics, and still they're solving them not with any of those necessarily, but with hygiene.
Correct. And even the COVID one, if the FTC and other government agencies had actually listened to science, it should have been a whimper of a pandemic and not the pandemic that it became. Again, hygiene and sanitation. They knew in May of 2020 that just using salt water, not even our product, but just using salt water, kind of made COVID a non-issue.
Yeah, I think that's pretty enlightening to see, and as he mentions there, having studied through that, that's pretty interesting. So, as we talked about, or getting into this, if pharmaceuticals aren't the solution necessarily, you mentioned it, and I think so. There's a place for pharmaceuticals. I've taken that chance in my life and used them where they have a place to do. But if pharmaceuticals weren't the real solution to these pandemics in the past, you talked about it. What did solve some of these, and what do you think? You talked about even just a saline solution in the nose.
Again, hygiene and sanitation have solved them all. I mean, that's really where it comes from, and I think that public health truly needs to get on board with that. If they can't give up on the whole idea of pharmaceuticals in public health, I'm not saying give up on the idea of pharmaceuticals, period, but public health agencies, the Surgeon General, the CDC, these kind of organizations, they just need to get off of the bandwagon of pharmaceuticals, and they need to get out there and teach people about, the four pillars. I haven't mentioned this yet, but the four pillars of great public health policy is obviously exercise. We need exercise, nutrition. We need good nutritional policy. And a one-size-fits-all nutrition policy is not good policy. We can get into that later. We need to talk about public health should be talking sanitation, making sure that trash and we have clean water, not, Flint, Michigan clean water with lead, but good water. And obviously hygiene, personal hygiene. I mean, personal hygiene and sanitation are kind of the same, but one is for the community and one is for individual. But public health really that's what they should be focusing on. And I think that that's what our products, that's where we're focused on. And so that's what we'll be talking most. But I do think that exercise and nutrition, I mean, I obviously need to lose some weight. I acknowledge that. I used to be bigger. In my own nutrition journey, I read a couple of books that made sense to me and made me want to be a vegetarian. And I was actually a good solid vegetarian for like a year. But I blew up to like 325 pounds, and so obviously it doesn't work for me. I have a neighbor who has been a vegan for 25, 30 years, since before his kids were born, and he's healthy as can be. I mean, he's a little cray-cray, but no, I'm kidding. He's not. He's actually a really nice guy. I play cards with him, cribbage, a couple nights a week. But he's a vegetarian. He's a vegan, and it works for him. It obviously didn't work for me. But those are all things that public health should be working with people so that they understand what it is.
Yeah, and I think that's the key here, because it seems like the one-size-fits-all pharmaceutical umbrella is where it typically goes to. But seeing other things, hygiene isn't something that's pushed very often and pushed in different areas, and not just washing your hands, but everything else that goes along with it, even with the product we have, Clear, with nasal hygiene. Just not even, I would have never known of that whole topic. And so these are all areas where we are lacking, because the go-to is maybe pharmaceuticals or what we currently have.
And the crazy part of that is, I mean, we could probably discuss this in an episode further down the road, is that my dad, again, he was having an issue with a lot of kids in his practice. He was a family physician out in West Texas, and he was having an issue with a lot of kids in his practice that were having recurrent ear infections. And the go-to for that is just give them antibiotics, bombard them with antibiotics. And he understood, or at least he, decided that he understood, that giving little babies that much antibiotics over and over is going to screw up with their gut microbiome. And, back in the 1990s, people didn't really understand the gut microbiome, but you have this balance in there, and he understood that if you kill it, bad things happen. And so he started looking on PubMed, and this is right when PubMed came online. He started looking for ways to prevent ear infections, and what he found was a bunch of the dental research studies, some of them that Kalkomakinen had done, where they actually showed that utilizing xylitol, the kids in these studies, they were dental research studies, but the kids in these studies, not only were they not getting tooth decay, but they were getting 42% fewer respiratory infections. And the mechanism of action for that was a study that was published in the Journal of Antimicrobial Chemotherapy in 1998. And that was a study where they showed that xylitol blocked adhesion of many of the pathogens, strep pneumo, H flu, MCAT. We learned later that it also does it for staph, and we learned later in 2020 that it does the same thing for a number of viruses, which we hadn't looked at viruses prior to 2020. But anyways, that was again, when my dad started using that in the practice, in his medical practice with the kids with ear infections, otitis media, they stopped getting sick. And many people that have chronic otitis media have other respiratory issues also, like allergies and asthma and other issues. And a lot of those other issues were also getting cleared up. And we know since then, there have been papers that have been published about that, where if you have chronic respiratory issues, chances are pretty high you have a biofilm buildup in your airway, which is causing that. And xylitol is effective at breaking up those biofilms. That's really where the hygiene hypothesis and all of that comes in. Again, we're not talking about overwashing. We don't think you should be sitting there washing constantly because you do have to maintain that state of eubiosis.
So we've walked through with Semmelweis, Sarah Jo Baker, John Snow, a lot of those in history that have taught us a lot of things. And then we come fast forward to Dr. Makinen, and then Dr. Jones, your dad, who did all this, collected it all together and brought it there. A lot of information captured. We had nasal spray that we're aware of and all the information you have. Did Clear, and you included, make efforts to educate this during our last pandemic? Did you make an effort?
Yeah. And we got sued for it.
Wow.
No, we did. Again, when in 2020, when COVID happened, we were just as caught off guard as everybody else. We didn't know that xylitol did anything or our product would do anything to a virus. And so we were sitting there and watching things play out and worried about what was going to happen. And it wasn't until shortly after that we started getting calls from a couple of doctors saying, hey, you should look at what's in this because we're using it on patients. They normally would have used saline, but they had ours and they were using it and they saw good results. And, and so we actually started doing studies with viruses. We did one, and what it showed was that the grapefruit seed extract, and this was a total surprise, the grapefruit seed extract that we use in the product, which we've used as a preservative at a very low percentage, actually destroyed the SARS-CoV-2 virus as effectively as a 70% solution of alcohol, which was really outstanding. You couple that with our understanding of how the nose cleans itself, the whole mucociliary clearance cycle, all of this stuff, and that gave us some hope. But at the same time, there was a paper that came out of the University of Tennessee where they showed that had nothing to do with us. It was actually another company in Argentina that paid the University of Tennessee to do this study looking at how xylitol blocked adhesion of SARS-CoV-2 from adhering to tissue. And, we had the data from that. And once we had the data from those studies, and it's not just 2 studies, we actually ended up doing 3 or 4 studies to figure out what exactly it was that it was killing the virus in our nasal spray before we figured out that it was the grapefruit seed extract. But if you have something that blocks adhesion of a pathogen, whatever it is, and something that destroys it, if you understand the mucociliary clearance cycle and how your nose and the snot flow around and trap and get things, it would be pretty obvious that, using it, if not helping and if not stopping it, would really help a lot. And then there were studies that came out of Vanderbilt University in Tennessee, in Nashville, where they actually were just looking at saline. And they had 60 patients over the age of 65, and they all had COVID. They all tested positive. They all had symptoms, so you weren't getting asymptomatic patients. But they just used salt water. And 100% of the patients were better in like a week. I can't remember the exact time frame, but it was a pretty short time frame. And, I started realizing that something was wrong with the government and how they were handling this, because when we went and said, hey, why isn't the government talking about this? Again, this is months and months before there was ever an idea of, a vaccine. This is in June of 2020. In fact, I know we had all the data for it because we went and we worked with a doctor to try to get a study done here in the United States looking at nasal hygiene, our nasal spray, in people with COVID. And we submitted that to the FDA and said, hey, can we do this? And that was the end of June of 2020. 5 weeks later, the FDA came back and said something along the lines of, I'm paraphrasing, you don't allow drug action studies to be made with cosmetics because Clear is a cosmetic. It cleans. That's what it does. That's how it's classified. especially with a biohazard level 3, whatever SARS-CoV-2 was. And so we weren't allowed to do human trials to see how it worked. One of the doctors in this study, they actually pulled back and said, okay, well, we don't have to have the FDA's permission to go and do a pilot study. And so he went and did a small pilot study where they used Clear, and all of the patients that used Clear, it's a small study. It was like 5 people, 6 people, half of them using Clear. But the people that used Clear were all better in a couple of days. They were testing negative. And again, we went to share that information with the government, and they ignored it. After that, we actually, we're trying to find out every way we possibly can to get through this good molasses government healthcare system. And we actually worked with some doctors to put together a petition to the CDC where we listed out all the studies of how salt water works, how xylitol works, how it blocks adhesion, how it destroys the virus, iodine nasal sprays, all of this other stuff. And we tried to get that through to the CDC, and the CDC ignored it. In their response to us, it was rather apparent that they didn't even open the attachment where the petition was. They just said, no, we've got it under control, and we're going to leave it how it is. Again, all of this was well before there was ever a vaccine. So, yes, we did try to do a lot.
Amazing. Yeah, that's troubling. Well, tell me, what needs to change? What needs to change regarding public health and how we treat and react to pandemics if they were like COVID in the future?
I think that you need to get doctors out of public health. Doctors are trained to look at everything as a drug and a solution, an illness and a drug and a solution. And as long as we have physicians running the CDC, and that's really what we're going to get, because that's what they're educated in. I think they need to have hygiene and sanitation experts be in there that really understand that. Epidemiologists that aren't doctors, that aren't learning about pharmaceuticals, in there running those organizations to make sure that people are being taught. And, there's incentive programs, both positive and negative. I mean, the CDC did a great job. Let's say they did a good job when it came to tobacco use. That was a public health menace. I mean, I think my personal opinion is I think sugar is a bigger menace than tobacco was. But the CDC actually did a decent job with the HIV crisis, because they were going out and talking about condoms. They were going out and talking about physical barriers, hygiene, and it was the other government agencies that were trying to do research that actually got the gay community up in arms and pissed off at them because they weren't allowing a lot of these experimental drugs that they knew worked and helped, and so they were going outside the country to get them. But again, it was hygiene and sanitation that really put an end to that.
Yeah, it seems the answer to a lot of things, and it's just simple instead of overcomplicating. So another pandemic's declared. What do you suggest the average citizen does?
If there was another pandemic declared, I mean, it depends on what kind of a pandemic.
Sure.
I mean, if it was, moldy toenail fungus, listen to what they say. I mean, again, we've had this ongoing pandemic of tooth decay for decades now. And that even going back to it, that even ties into COVID, because they had studies out of Israel and out of Canada early on where they showed that people that had periodontal disease were 8 times more likely to be hospitalized and die if they did catch COVID. But yet the government public health never came out and talked about that. And periodontal disease is not that hard. It's just, hey, brush your teeth, use a better mouthwash. But if nothing changes, probably the same thing I would tell people, not the first half of 2020, because the first half of 2020, I really still believed that our public health agencies and our government were trying to do the job. Up until probably July of 2020, my idea of what government employees were is really, people who've watched episodes of The Office. It's really that. It's people bumbling around, trying to get the job done, doing the job, but really not being that effective at it. And it wasn't until July, the end of July, when the FDA came and said, hey, we don't allow drug action studies to be done, even though you have all of this basic science that's been done to back up the logic and the reasoning behind it. You have 20 years plus of safety data. And then you have the FTC, who goes out and sends warning letters to companies in the nasal hygiene industry, telling them not to share published research data, saying, we don't have any data showing that it doesn't work, but we don't like the data that you have showing that it does work. And even now, 5 years later, they still don't have any data showing that it doesn't work. So if nothing changes, I would tell you to do the same thing that I started telling people in August of 2020. Listen to what the government says. Listen to what they're telling you on the news and do the exact opposite. I mean, I did that. I mean, I'll even say that listening as the COVID pandemic was rolling out and they were talking about these vaccines that were on the horizon, I planned on, getting one and having my kids get it. And it wasn't until August or September that I started paying attention enough to what was going on in the media and the podcast that I actually listened to a podcast with Fauci, the great I Am the Science Fauci. I listened to it, and he was talking about the studies, and I was paying attention. I was, great, we're going to have some vaccines. And he said, and he talked about how the studies were going in the primates, and all the primates got sick, but none of them died. So it was great, but, it wasn't there. And he said, yeah, it's still going to be, another couple of months, years. It was actually going to be, I think, years. And it was like 2 months later, they came out and said, these things are 100% effective at stopping transmission. I'm like, wait a minute. Like 2 months ago, you just said something different. And so it was then that I realized, I said, there's not a chance in heckle. I don't want to say anything bad, but there's not a chance I'm going to take this vaccine because they're lying to me. They're blatantly lying to me. And if they're lying to you about one thing, what else are they lying to you about? Safety? Efficacy? I mean, they were lying to me about efficacy. Obviously, we found out later they're lying to us about safety too.
It seems like, in my experience now here at Clear, that more and more data has come out, even subsequent to that, studies and everything, continually supporting what your initial proposal or we're trying to educate on was Clear and nasal spray and hygiene and all of that.
Yeah. There's all kinds of studies. Again, the FTC doesn't like it, and so they say you can't share it. But it's on our webpage. The study that was done that I mentioned earlier at University of Tennessee where they looked at adhesion, the company in Argentina, they actually had a nasal spray using iota carrageenan, which is a seaweed extract. And they know that iota carrageenan has an effect on rhinoviruses. You can buy iota carrageenan nasal sprays outside of the U.S. in many countries as a preventative or a treatment for colds and flus. And that's what they were looking at. For some reason, and I don't know why, and I've tried to reach out to the company and don't get an answer, I don't understand why they use xylitol as the placebo, but the placebo worked better than the iota carrageenan. So there were studies that were done. That company went and did a study on hospital workers using iota carrageenan, which again we know is less effective than xylitol, but they used iota carrageenan, and they used it in a nasal spray 4 times a day in hospital workers in Argentina, and it reduced transmission of COVID by almost 80%. Okay? That's a phenomenal reduction. There was another paper that was done that came out, this study was done in early 2021, that was done in India where they were using a xylitol-based nasal spray with clove oil, which acted as a virucidal agent. So very similar, very, very similar to Clear, our product, where they used it 3 times a day, and they showed a 62% reduction over the placebo. The placebo is saline, and we know from many other studies that saline reduces it by anywhere from 10 to 30%. And so you've got a huge reduction in just using an iota carrageenan nasal spray or utilizing a xylitol-based nasal spray.
Those are the facts, right? You can't argue that when it's done there, and they see that.
Well, the government argues facts. They like to argue facts.
Yeah, that's true.
So,
well, it's an interesting topic, and I'm sure you could speak for hours on this with your research and study. I think it's fascinating to see a look back in the last 100 years, the solving of pandemics have been hygiene. something that we can all do simply and do that. I appreciate my doctors. They help me when I'm in need, but I also have a new kind of understanding that there's a lot I can do by myself initially to prevent some of the things that come. So any final words from you on this episode?
No, just, stay clean.
Stay clean. Wash your hands. Wash your nose.
Brush your teeth.
Brush your teeth. All good advice there. So anyway, great another episode of our podcast, Clear the Air. Thank you, and we'll see you on the next one.
This episode of Clear the Air was hosted by Nate Jones, co-hosted by Joel Melton, produced by David Monk, associate producer Matthew Davis. Video and audio were edited by Caleb Scoresby. Research by Sabre Bills. Music by Augusto Diniz. If you enjoyed this episode of Clear the Air, be sure to follow, like, and subscribe so you don't miss out on the latest episode. Have a favorite episode? Share it with a friend. New episodes of Clear the Air are published weekly on YouTube, Spotify, Apple Podcasts, or wherever you listen to your podcasts. Thanks for listening. We'll catch you next time.